Hi everyone and welcome to this week's version of Isamu Rat Care. So what we're going to be looking at today, and while we've got an interesting concoction of things here, is medication and how to medicate your rats. It's something that happens quite regularly in keeping rats. You'll normally get one ill at some point in its life. Not every rat gets ill, but when it does you quite often have to give them meds. Giving such an intelligent animal meds can be a pain in the backside, and I'm not underestimating here. Many of you will have tried and failed, but there are a few different options, and I'm going to talk through some kind of very basic ones, bearing in mind that there are many different ways to kind of feed rats meds and try and hide them and disguise them, and then there are some other options should you not be able to do that. So first option, what we normally get with medication, we get medication in two main different forms as a rule. We'll get tablets, so here's a couple. This is half a Coamox tablet. Coamox is also known as Sinulux or Clavaceptin or Novoclav, etc. It's a kind of antibiotic commonly known as penicillin. Monster is currently on that. She is also on Enrobactin, so this is a good description of the other kind of medication we get. So Enrobactin is a liquid, so you can just see it kind of clear thing in there. It's also sometimes known as Baytril, or Enrobactin being the kind of proper name for it, but Baytril is one of the brand names, and it's the most commonly prescribed medication for rats. It is quite good in its place. It is not perfect, and you'll find some vets do sometimes kind of prescribe it because it's the only drug that is licensed for rats. Many other medications are safe for rats to take, but Baytril is the only one that's licensed for them, so often vets feel they have to prescribe that first, but in reality there's many other different kinds of meds that are often more appropriate. But in the situation which we're talking about with Monster is a kind of respiratory infection. Enrobactin and Coamox is a kind of a good first step to try to see whether it helps with it. So how do we go about giving these two different meds? So first things first, I'm going to explain, for those of you not familiar with it, how you measure things on a syringe. The vet should show you, but I do know that there's quite a few people out. It's very basic, so just ignore this and I'll try and keep it brief if you know what you're doing. So this is a 1 ml syringe. This is the most common one, so I try and get it so it can actually focus. Common one given by the vets. So if you notice here, we've got 0.1, 0.2, etc. and then some little graduations in between. So normal doses with rats will be well within this. I think the only thing that I can think of that hasn't been has been did you use Galistop, because you were giving 3 point something mil every 3 days. It was a nightmare. We shan't go through that one here. Most things tend to be kind of down this bottom end. A few things are a bit bigger. Ideally you want the smallest fluid possible to get into the rat because it's slightly easier, but there are kind of balances with that because you also want to be able to accurately measure it out for their weight. So for Monster, she is on, sorry I've got the doses written down on the board up there, 0.17 mil of Enro. So how I do with that is you have to make sure that the thing is absolutely at the bottom when you're starting out. Ideally you can get some syringes that actually fill that little tube bit as well, but these ones don't, sadly, and they're the most common ones. So what we're trying to do now is going to get some Enrobactin into this. Right, okay. So I've now got, what I've gone for is I've gone for slightly more than what you need. So if you can read that, trying to get it so it can focus, it is level with the 0.2 millimeter line. Now I need to go to 0.17, so we're actually looking at going to that halfway mark, which is 0.15, and then counting 2 of the smallest marks down. It's not hugely clear, I'm afraid, on this, but it makes much more sense in person. So I'm just going to kind of squirt out the excess. I tend to go over and then reduce it. And then what we've got is the 0.17, which is perfect. Right, the reason I'm going to leave it there will become clear shortly. So I've got to now give Monster 2 lots. Now, what I also have to give her is some tablets. Obviously I can't just stick that in her mouth and hope she'll swallow it, because if she does try and swallow it she'll choke, in reality she's not going to swallow it, and they hate it. So what I do, and you can get pill crushers to do this, But what I really find works the best is this is a tiny little dish, a tiny little ceramic dish, and I find this underside here makes a really good mortar, and I tend to use a spoon as a pestle, because one thing I found with rats, particularly with Coamox tablets, because they are quite nasty tasting, I think it's pretty fair to say. I haven't tried them myself, but it's one of the ones that I struggle the most to kind of disguise for the rats. So what I'm doing here is crushing it down as finely as possible. By crushing it finely, I can dissolve it more easily, and by dissolving it I've got more of a chance of hiding the flavour. What I find, particularly with Coamox, not all tablets are as bad, steroids are dead easy to get down them, for instance, but Coamox, if there's any little lumps and they bite down on it, they will detest it. And the other thing is, because Monster is a bit of an arse when it comes to taking meds, I actually have to syringe this. Anyway, so I can disguise it in many different things, and I'll talk through some of the options on that. But Monster is, I've gone to the last resort with it, so I tend to make it very, very fine as possible so I can dissolve it, and then I'll syringe it, and I'll show you how I do that later, because it's actually very difficult to syringe tablets unless you've kind of got the knack of it. So ideally, in the majority of cases, you wouldn't want to syringe meds. Syringing is a quick, straightforward method to make sure the rat gets the meds, but it does carry risks. So if you syringe a rat, they can take too much in their mouth and they can aspirate, so that means they'll choke on it effectively, and that can actually cause them lung problems, it can cause them respiratory problems. You can get aspiration pneumonia, for instance. In a rat that gets, well, so syringing isn't a pleasant situation. The rat is struggling, it doesn't want to have the thing squirted in its mouth, it doesn't enjoy it. Even if you're quick and quite efficient at it, it can be quite a stressful thing. If you've got a rat with a heart problem, or who's very, very ill, or is in respiratory distress, the likelihood is this will make them more stressed, and that could make them worse. So where you can avoid syringing, but it's better than you syringe in most cases than the rat not get the medication at all. So it's a good backup option. So how do you disguise medication? So I've got a few of the kind of common options that I use here. So my first go-to is good old liver paste. This is sold for dogs, for treats. They quite like it. Generally speaking, I can disguise most things, at least initially, for the rats in liver paste, because it's got a quite strong smell too, and that's quite important, as is a slightly oily consistency. So oil helps mask the smells, so they can smell the oil, they can't smell the horrible, nasty medication. So I tend to go first of all for that. That works majority of the times. You've also got things like, this is Moo Mix, it's kind of a soakable stuff sold by Rat Rations. I think I covered the recipe for it, so I did develop a recipe for that, but it's nothing particularly fancy, it's just high calorie food supplements that's got a nice flavour that some rats like. I covered it in the last video I did, which was on the feeding the oldies and for the kidneys. But you can buy it from Rat Rations, and as you can see, I'm lazy and have, even though I'm perfectly capable of mixing it myself. So that's another thing you can do. You can actually use baby foods and such as well. One of the key things to try is try both sweet and savoury, because some rats like sweet, some rats like savoury. Most of my rats like savoury, but they don't get very much sweet because I'm mean, and they will tell you that, and I don't give them yoggies or anything like that, so they're mostly quite fond of savoury stuff. Here's another, so different dog's foods you can use. This dog food, for some reason all my rats go mad for it. It's my kind of fallback option if I can't get them to take it in liver paste or something like Fish for Dogs dog food, which I keep in quite a lot. That usually passes. Doesn't always. Some rats, particularly rats that have been on medication multiple times in their life, they get a bit smart to stuff, which is where I am with Monster now. I used to be able to fool with that and this kind of thing, and now I can't. So those are a few things, and the idea is you want to give them as little as possible of the mushy stuff that you can, but enough that you can disguise it. And what can also help with that is actually putting a few drops of oil on top. So mix it into some kind of dog food or some paste, or malt paste is another good one, and mix it up. And if they're still a bit suspicious, put a couple of drops of something like olive oil, salmon oil, linseed oil. That forms a thin film over the top and again blocks the smell so they don't smell it too much. If you're grinding up a tablet, a good trick that you can try as well is to sprinkle something that's quite nice tasting, that's kind of crummy texture, so that they bite down on that as well. So there's a bit like egg biscuit is quite good for that, crumbled up, or even I suppose bits of bread or biscuit or something that kind of gives a nice flavour when they crunch on it, not the nasty medication flavour, and just mix that in the liquidy kind of mushy stuff as well, and that goes down quite well. And then I would recommend putting the rat in a small cage or carrier where they can sit and eat undisturbed. One trick which sometimes does work though, where you've got a rat that's particularly awkward, reverse psychology, so have them in the main cage with the other rats, at least a few of the other rats. If you've got a large group, take a few out, but you've got enough that there's competition, then offer it on the spoon and then hold the other rats away with your hand, and they're so desperate to get this treat that's just theirs that they'll scoff it really, really, really quickly before the others get a look in. That works quite often as well, so a bit of reverse psychology for the rats, and it doesn't always work, but it's worth a shot with that one as well. So what I tend to do with disguising the meds is I will give, the first time or two that I give it, I will try a couple different options, but then as it goes along I will only kind of try an option once and then syringe it if they don't take it. The reason being is, to be fair, I don't have a load of time to try things all the time. I also don't want to waste a lot of the meds. You only get a set amount from the vets and you need to make it last as long as possible for the full course of the treatment. So I do try and kind of make it reasonable. Plus I think the longer it goes on, the less likely the rat is to actually take it, because by that point they don't trust any food. So I try to try one or two things. If it doesn't happen, move on, syringe, try again the next night with something different, and so on. It can lead to a lot of a lot of opened but partially eaten baby food jars around and that kind of thing. But you can freeze them if you do that. Stick it in some ice cube trays and then you've got it for next time, and just defrost a kind of blob to put it in. So that's disguising. What I'm going to do now is show you how I'm going to get this in the syringe, because this is what I'm going to have to do for Monster. So what I use for this, you can use water as well, but this is just a little coffee syrup I got. It's actually hot chocolate syrup, but it's the same thing as coffee syrup, which I got a little while ago in a nice little gift set. I have no intention of taking it. In fact, let's not just use that, that's got the emmer in. I have a lot of random little syringes. So what I'm going to do is put a little bit of the syrup in this, and then add it to my mortar here and mix it up with the powder. And the reason syrup is slightly better than water is it's slightly thicker consistency, so it holds the liquid a bit more. So I'm literally putting the smallest amount that I can, but that I can get it into a kind of suspension, because I don't want to have to give a lot of fluid if I can help it. You can actually do this if you get a tablet that is massive and you want to give a small dose to a rat, and the vet should advise you on how to do this, but some tablets like Doxy, or even some of the larger steroid tablets, or Tramadol actually is quite big, and it can be easier to make it up. So getting close to the right consistency now. It can be easier to make it up in a bit of liquid and then measure out the liquid correctly. It's called making your own solution. I might cover how to do that at some point, but it's kind of like, it's a bit beyond this one. So you see there now, that nice little pile of powder has now turned into a nice kind of solution, and that's quite good. And what I'm going to just do is suck it up into my Emro syringe, so I just have one syringe to give her. Some medications you can't do that with, you can't mix. So Doxy and Baytril you wouldn't give at the same time, like this. You would want to leave it a couple of hours between at least, but it just really depends on what way the medication works. So Baytril and Co-Amox work in a similar way, so they don't counteract each other, they just target different bacteria. So that's why I'm grabbing them. Interestingly, Co-Amox does not work on myco, but there's a lot of respiratory problems that are not myco, and I think a lot of people don't realise that. Myco gets banded around all the time. My rat has a respiratory problem, it must have myco. It is a common cause, particularly in rescue rats and such, but it's not the only cause. Right, so we're pretty much there with this. There will be some wastage from this method, but if you tell your vet that, they'll make sure that your dose is at the higher end, so you could afford a little bit of waste. Particularly when you're talking tablets, it's not as accurate dosed as a liquid anyway, because you're talking half, quarter, and so on. Right, so I've sorted And I'm going to turn this video off for a bit while I just go and get Monster, and then I'll come back and I'll finish it with showing you how I syringe her. So I have Monster now, who probably already knows what's coming at this stage because she's had this for a little while now. Well, if you just take your meds, it would be a lot easier. It would. You can probably see slightly from the video, but she is slightly flank breathing. She's not bad. She is improving a bit, I think. But yeah, she just needs to get better, don't you, Missy? Yes, you do. Good girl. Right. So the secret to syringing is a towel. This is a rather chewed towel. It is the rat's towel, and they don't love it because they get syringed in it, amongst other things. Generally things like cleaning the tails and cutting nails and such, so they know it's not really associated with much fun. So what am I going to do? So remember the syringe from earlier. I'm just going to make sure that I've got as little air in this as possible, because I don't really want to squirt air into Monster if I can help it. So I'm just kind of working the bubbles out a little bit. Right, so we're good to go. So the first thing that I do is I'm going to wrap Monster up in the towel of death. So this is sometimes called the Rat Burrito. Basically what we're doing here is we're partly doing this, good girl, partly doing this so that she can associate the bad experience with the towel and not with me, and we're partly doing this because it also stops her struggling too much. In a Monster case, she's not a massively strong rat, but in some other rats' case they are, and it really does help. So I'm going to do this quite quickly, and I'm going to describe what I've done afterwards because I don't want to stress Monster out. I'll give her a break in the middle of it because I don't want to give this all in one dose because it's quite a lot. You can see she's a bit of a wiggly monster. Aren't you, Missy? Right, come on. So I'm going to try and squirt this at the back of her mouth. I'm going to get it behind her teeth. Yeah, she does not like this. Don't be afraid of repositioning. If you're not quite in the right position, you want to have a good hold of the rat, so that you can kind of stop them getting away, but also not crush them, because this ultimately is a sick rat. So I'm just going to... Right, so I've given about half there now. So what I did was I pushed it just in there. This is a good description with me, but you have to get it at quite an angle, and then you have to push it quite far back because rats have little flaps, which is part of being rodents, which is what they use to stop themselves when they're gnawing, getting crap in their mouth. So hopefully she has now swallowed that. Give a bit at a time because they're perfectly capable of spitting it out. Shush, shush, shush. I'll just give her a bit of a break. It's something you have to kind of fit around the rats on this. Sometimes you can do it very quickly. Sometimes you need to give them time to reposition in between. Right, oops. Give her the rest of it. There, shush, shush, shush. Go on. Right, so I managed to get the rest of it in there. So you noticed I did it in two blobs. Generally speaking, a good rule of thumb is aim to do maybe 0.2 at a time. You can give a little bit more on that, but particularly small rats have very small mouths. And the last thing you want to do is cause them to aspirate. It's not, well, it's dangerous basically for them if you do aspirate. So if you give them too much in one go, it can quite easily, they'll start choking on it and it can go into their lungs. Which isn't nice at all. But if you do it quickly, firmly, but without kind of terrifying the rat, it went quite well with Monster actually. What are you up to? That works well. Sometimes you'll squirt it in and they will move in such a way that it immediately just oozes out of their mouth. Or actually I have once managed to squirt myself in the eye when medicating a rat because they closed the mouth in such a way it squirted back and straight into my eye, and you don't want phenobarbital in your eye, it really stings. That was quite funny. I think the rat got revenge on that one. It's probably fair enough. But if it does come out, don't worry too much. Just try and smear it a bit around the face and they will get it off by washing. They will not get the full effect of it, but it's better than nothing. And it's something that you sometimes do have to resort to. Even me that does do a lot of syringing, so knows what I'm doing. So as you can see, Monster is not overly stressed by that after that now. And she's quite relaxed around me, despite the fact I just was very, very mean to her. What I tend to do afterwards is give them a bit of a treat, but you do have to give them a little bit of time so that they can swallow the nasty taste in their mouth, because it's not particularly pleasant for them. Though I do think using the sweetened syrups helps slightly. So that's it. Monster is all syringed. You can see that it's not too bad. I will do a quick mention actually of what to do when the syringing isn't an option. So in certain cases you might be dealing with a rat that is in really severe respiratory distress. They can't breathe and they're not eating, so you're not going to want to syringe the meds in because it's likely to make them a hell of a lot worse, and you're not going to want to hey Missy, I might get the treat, don't mind me. You're not going to want to disguise it in food as well, because the chances of them eating it are slim to nil. We're friends now, it's quite good. So one of the options that I would think about is you can nebulize. So you do need a nebulizer for that, and the vet can help you set up appropriately. There's a lot of guides out there for making your own, but make sure you do it with the vet's advice so that you're using the appropriate solution. What are you up to, miss? You dropped your treat? Yes. So that can be quite useful for rats with respiratory problems that are long term, but bear in mind nebulizing also stresses the rat out, so it's not the be all and end all, it's just a useful tool sometimes. And the final option is injecting. So the vets will normally do the injecting for you, but in some cases where you've got a rat that will need regular injections and the vet trusts you, they may allow you and teach you how to inject yourself. I will say from experience, rat skin is surprisingly tough. It isn't necessarily a super easy option. I tend to do it with somebody holding the rat, so we'll do it normally on the floor. Let's see if I can kind of, no, I probably can't describe it, but usually one person is holding the rat down like that, but with enabling access to the scruff, and then I will literally just pinch up the scruff. Monster is not the best demonstration for this, having been syringed, and push the needle in that way and syringe quickly. Or you can go forward as well, it's one of those, but the vet will kind of show you how to do it, or they should do if they're going to let you do it. They will also normally make up the syringes for you, and you have to make sure that the needles go back or to go to an appropriate sharp spin, because you can't be making sure that's in normal waste because it's not safe for the binman. So that is an option, and it's an option that can be quite helpful in, I would say, emergency situations. If you've got a very sick rat, if you've got a rat that isn't sick, injecting them is a bloody nightmare because they've got a lot more life in them, and it's a lot harder to do. But there are some medications that you can get the vet to inject that lasts for, let's say, 5 to 7 days. So things like Draxin, which is a respiratory medication, and particularly effective against myco, that lasts for about a week. There are some other things as well. Dex injections, for instance, which is a kind of steroid that can last for 5 days to a week as well. So that's one to bear in mind and discuss with your vet if you're having an absolute nightmare and you can't risk syringing. But those are the main options for medication. I will say be careful if you ever think of doing home medication. It is something that can be done, and some vets will give you extra because of that, but make sure you know how to dose, make sure you know when to dose, and not every ill rat needs medication. You need to be sensible, because otherwise you can cause more problems by giving the wrong medication too little or for not long enough. So just be careful with that, and take veterinary medication advice. In the UK particularly, you should not be getting medications without prescription. It is illegal. So be sensible. In other parts of the world you can get it, but you need to be very careful that you know how much you're dosing and when to dose. Otherwise you could make them sicker. But I will say that for those of you that the vet does trust to do things, it is peace of mind to have a certain amount of medication on hand to start in case of emergencies. My rats do still go to the vets, but we kind of have an arrangement where they're quite happy for me to start them off on the appropriate meds, and then they'll check and kind of give me more as needed. Oh dear miss. Right, I should probably get Monster back because she's hungry, and she apparently did not enjoy that treat even though she stole it off me. She just wants a bit of an explore. Oh no, she's wiping her mouth. I don't know if you saw her little shuffle along there. That's I didn't like that medication. So I will pop her back to a group and give her some nicer food, and hopefully she'll be happy with me. See ya, and I'll do another one shortly. Bye for now.